Question 1. A pharmacy technician receives a prescription for Celexa 20 milligrams daily. The patient states they are currently taking an herbal supplement for depression. Which of the following is the most appropriate action for the technician? I. Advise the patient that herbal supplements are generally safe and can be continued. B. Inform the patient that they should stop taking the herbal supplement immediately. C. Process the prescription and tell the patient to consult with the pharmacist. D. Flag the prescription for pharmacist review, noting the patient's herbal supplement use. Answer D. Flag the prescription for pharmacist review, noting the patient's herbal supplement use. This question tests the technician's role in identifying potential drug interactions and understanding the scope of practice. The keyword most appropriate action directs the technician to prioritize patient safety and adhere to professional boundaries. Celexa, citalopram, is an antidepressant, and many herbal supplements for depression, like St. John's wort, can have significant interactions, such as increasing the risk of serotonin syndrome, which requires a pharmacist's expert assessment. A pharmacy technician should always flag such potential interactions for the pharmacist to review and counsel the patient, never providing medical advice directly. Remember, technicians identify potential issues, but only pharmacists provide clinical counseling. Question 2. A prescription reads, Lantus 10 units subcutaneously daily. The patient brings in a box of Lantus SoloStar pens, each containing 3 milliliters of insulin at a concentration of 100 units/ml. If the patient starts a new pen on the first day, how many days will one pen last? I. 3 days. B. 10 days. C. 30 days. D. 60 days. Answer C. 30 days. This question evaluates a technician's ability to perform essential days supply calculations for a common medication. The key information includes the daily dose, 10 units, and the total units per pen. Each pen contains 3 milliliters *100 units/ml equals 300 units of insulin. To find how many days one pen will last, divide the total units per pen by the daily dose. 300 units/10 units/day equals 30 days. It is crucial to understand that even though the pen is 3 milliliters, the calculation must be based on the total units of insulin available, not just the volume. Always convert volume to total units when calculating days supply for insulin. Question 3. According to federal law, how often must a complete inventory of all controlled substances be taken in a pharmacy? I. Every 6 months. B. Annually. C. Every 2 years. D. Every 3 years. Answer C. Every 2 years. This question assesses knowledge of federal regulations pertaining to controlled substances, specifically inventory requirements. The critical phrase federal law points to the Drug Enforcement Administration regulations. The DEA mandates that a complete and accurate inventory of all controlled substances, Schedules 2, 3, 4, and V, must be taken at least every 2 years. This biennial inventory is crucial for maintaining proper accountability and preventing diversion of these high-risk medications. Always remember that while state laws might require more frequent inventories, the federal minimum is every 2 years. Question 4. A patient drops off a prescription for azithromycin 250 milligrams number 6. Take 2 tablets on day 1, then 1 tablet daily for 4 days. The pharmacy stocks azithromycin 250 milligrams in bottles of 30 tablets. How many tablets should the technician dispense for this prescription? I. 4 tablets. B. 5 tablets. C. 6 tablets. D. 7 tablets. Answer C. 6 tablets. This question tests the ability to correctly interpret dosing instructions and calculate the total quantity to dispense. The keywords are take 2 tablets on day 1 and then 1 tablet daily for 4 days. On day 1, the patient takes 2 tablets. For the subsequent 4 days, they take 1 tablet each day, totaling 4 tablets. Therefore, the total number of tablets needed is 2 day 1 plus 4 days 2 to 5 equals 6 tablets. It is important to break down multi-step dosing instructions carefully to ensure the correct quantity is dispensed for the entire course of therapy. Question 5. Which of the following medications is a proton pump inhibitor, PPI, commonly used to treat gastroesophageal reflux disease, G or D? I. Metformin. B. Omeprazole. C. Atorvastatin. D. Amoxicillin. Answer B. Omeprazole. This question assesses knowledge of common drug classifications and their uses, a key component of the top 200 drugs. The concept tested is identifying a proton pump inhibitor, PPI, and its indication. Omeprazole is a well-known PPI that works by reducing the production of stomach acid, making it highly effective for conditions like GERD, heartburn, and ulcers. Metformin is for diabetes, atorvastatin for high cholesterol, and amoxicillin is an antibiotic. Recognizing drug classes helps you understand how different medications work and why they are prescribed. Question 6. A pharmacy receives a recall notice for a specific lot of ibuprofen 800 mg tablets due to potential contamination. This recall is issued because the product could cause temporary or reversible adverse health consequences. What class of recall is this according to the FDA? I. Class 1. B. Class 2. C. Class 3. D. Class 4. Answer B. Class 2. This question evaluates understanding of FDA drug recall classifications, which is vital for patient safety and quality assurance. The key phrase, temporary or reversible adverse health consequences, directly corresponds to the definition of a Class 2 recall. A Class 1 recall is for situations where there is a reasonable probability that the use of or exposure to a violative product will cause serious adverse health consequences or death. A Class 3 recall is for situations where use of or exposure to a violative product is not likely to cause adverse health consequences. Understanding these classifications helps technicians prioritize urgent actions during a drug recall. Question 7. A prescription calls for 500 milliliters of a 20% dextrose solution. If the pharmacy only has 70% dextrose solution and sterile water, how much 70% dextrose solution is needed to compound this prescription? I. 100 milliliters. B. 143 milliliters. C. 200 milliliters. D. 350 milliliters. Answer B. 143 milliliters. This question tests the ability to perform calculations for dilutions, a common task in sterile compounding. The concept is based on the alligation method or the C1V1 equals C2V2 formula. You want to prepare 500 milliliters of a 20% solution using a 70% stock solution. Using the formula C1V1 equals C2V2, where C1 is the concentration of the stock solution, 70%, V1 is the volume of the stock solution needed, unknown, C2 is the desired concentration, 20%, and V2 is the desired total volume, 500 ml. So, 70% asterisk V1 equals 20% asterisk 500 milliliters. This simplifies to V1 equals 20 asterisk 500 slash 70 is equal to 10,000 slash 70 is equal to 142,857 ml, which rounds to 143 milliliters. Mastering dilution calculations is crucial for accurate compounding. Question 8. A patient presents with a prescription for lisinopril 10 milligrams daily. What is the primary drug class of lisinopril? I. Beta blocker. B. Calcium channel blocker. C. Angiotensin-converting enzyme, ACE, inhibitor. D. Diuretic. Answer C. Angiotensin-converting enzyme, ACE, inhibitor. This question assesses knowledge of common drug classifications, which is essential for understanding medication mechanisms and potential interactions. Lisinopril is a widely prescribed medication for hypertension, high blood pressure, and heart failure. The keyword lisinopril should trigger recognition of its drug class. ACE inhibitors work by blocking the production of a substance that narrows blood vessels, thus helping to relax them and lower blood pressure. Knowing the drug class of medications like lisinopril helps pharmacy technicians identify potential drug interactions and understand why a patient is taking a specific medication. Question 9. Which federal act requires pharmacists to offer counseling to Medicaid patients regarding their prescriptions? I. HIPAA, Health Insurance Portability and Accountability Act. B. PPPA, Poison Prevention Packaging Act. C. OBRA 90, Omnibus Budget Reconciliation Act of 1990. D. FDCA, Federal Food, Drug, and Cosmetic Act. Answer C. OBRA 90, Omnibus Budget Reconciliation Act of 1990. This question tests knowledge of significant federal pharmacy legislation, specifically those related to patient care. The crucial phrase, offer counseling to Medicaid patients, directly relates to the requirements set forth by OBRA 90. This act mandated that states require pharmacists to offer to counsel Medicaid patients about their prescriptions to ensure rational drug therapy and reduce adverse drug events. While HIPAA relates to patient privacy and PPPA to child-resistant packaging, OBRA 90 is specifically about the counseling requirement. Understanding these foundational laws helps ensure proper patient care and compliance. Question 10. A pharmacy receives a prescription for Xanax 0, 5 mg. Dispense 60 tablets. Take 1 tablet twice daily. This prescription is for a Schedule IV controlled substance. What specific DEA form is typically used by a pharmacy to order Schedule II controlled substances? I. DEA Form 41. B. DEA Form 106. C. DEA Form 222. D. DEA Form 224. Answer C. DEA Form 222. This question assesses knowledge of controlled substance ordering procedures and specific DEA forms. Although the prescription itself is for a Schedule IV drug, the question explicitly asks about ordering Schedule II substances. The keyword Schedule II controlled substances is crucial here. DEA Form 222 is the specific official form required by the DEA for ordering Schedule II controlled substances, which have the highest potential for abuse among scheduled medications that are still medically accepted. DEA Form 41 is for controlled substance destruction, DEA Form 106 for theft/loss, and DEA Form 224 for new pharmacy registration. Understanding these forms is essential for legal compliance and preventing diversion. Question 11. Which of the following is a critical component of medication reconciliation? I. Administering medications to patients. B. Educating patients on non-prescription remedies. C. Creating a comprehensive list of a patient's current medications. D. Dispensing new prescriptions to patients. Answer C. Creating a comprehensive list of a patient's current medications. This question assesses understanding of medication reconciliation, a vital quality assurance process. The concept of medication reconciliation is about preventing medication errors, especially during transitions of care, e.g., hospital admission, discharge. The keyword critical component highlights the core activity. It involves comparing the medications a patient is currently taking, including prescription, OTC, and herbal products, with new medications being ordered to identify and resolve discrepancies. This process helps ensure patients continue necessary therapies and avoids harmful drug interactions or omissions. Always remember, reconciliation is about comparison and verification, not just dispensing or administering. Question 12. A pharmacy technician is preparing to compound a sterile intravenous admixture in a laminar airflow workbench, IFW. Which of the following is the most appropriate step immediately after hand washing and donning personal protective equipment, PP? I. Begin preparing the medication immediately. B. Wipe down all critical surfaces inside the LAFW with 70% isopropyl alcohol. C. Conduct a final visual inspection of all components. D. Label all syringes and vials. Answer B. Wipe down all critical surfaces inside the LAFW with 70% isopropyl alcohol. This question assesses knowledge of proper sterile compounding procedures, focusing on maintaining aseptic technique. The keyword most appropriate step immediately after hand washing and donning personal protective equipment indicates a sequence of events question. After proper garbing, the next critical step is to thoroughly disinfect the interior surfaces of the laminar airflow workbench, FW, with 70% isopropyl alcohol, working from back to front and top to bottom. This ensures a clean, sterile environment for preparing the admixture, minimizing the risk of contamination before any actual drug preparation begins. Always remember, cleanliness of the workspace directly impacts patient safety and sterile compounding. Question 13. A patient's prescription specifies, take 2 tablets PO daily for 7 days. The pharmacy technician is preparing the medication. What does PO mean in this context? I. Per rectum. B. As needed. C. By mouth. D. Right eye. Answer C. By mouth. This question tests knowledge of common medical abbreviations, which are essential for accurately interpreting prescription orders. The abbreviation PO is a widely used Latin abbreviation from per os, meaning by mouth or orally. Incorrect interpretation of this abbreviation could lead to serious medication errors. For example, if a medication meant to be taken orally was given intravenously, it could be fatal. Always verify any unfamiliar abbreviations, but PO is fundamental and indicates an oral route of administration. Question 14. A hospital pharmacy receives an order for dopamine infusion at 5 micrograms per kilogram per minute for a 70 kilograms patient. The available dopamine solution is 400 milligrams and 250 milliliters D5W. What is the infusion rate in ml/HR? I. 525 ml/HR. B. 13 ml/HR. C. 25 ml/HR. D. 5 ml/HR. Answer B. 13 ml/HR. This question assesses the ability to perform complex intravenous drip rate calculations, a crucial skill in hospital pharmacy settings. First, calculate the dose in mg per minute. 5 micrograms per kilogram per minute * 70 kilograms equals 350 micrograms per minute. Convert this to mg/min. 350 micrograms per minute equals 0.35 mg/min. Next, determine the concentration of the available solution. 400 milligrams/250 milliliters equals 16 mg/ml. Now, find the volume needed per minute. 0.35 mg/min/16 mg/ml equals 0.21875 ml/min. Finally, convert to ml/HR. 0.21875 ml/min * 60 minutes per hour equals 13.125 ml/HR, which rounds to 13 ml/HR. This multi-step calculation requires careful unit conversion and attention to detail. Question 15. Which of the following drugs is commonly prescribed for high cholesterol and belongs to the statin class? I. Valsartan. B. Levothyroxine. C. Atorvastatin. D. Gabapentin. Answer C. Atorvastatin. This question tests recognition of common top 200 drugs and their primary classifications. The keywords high cholesterol and statin class are direct clues. Atorvastatin, brand name Lipitor, is a very common medication used to lower cholesterol by inhibiting an enzyme involved in cholesterol production in the liver. Valsartan is an ARB for blood pressure, levothyroxine is for thyroid deficiency, and gabapentin is for seizures/nerve pain. Identifying statins is crucial for understanding common drug interactions and patient counseling points related to muscle pain. Question 16. A prescription for a controlled substance is received at the pharmacy. The prescriber has written refill X2. However, the drug is a Schedule II controlled substance. What is the correct action for the pharmacy technician? I. Dispense the medication and allow 2 refills as indicated. B. Dispense the medication and inform the patient that it has no refills. C. Contact the prescriber for clarification on the number of refills. D. Dispense the medication and apply one refill only. Answer B. Dispense the medication and inform the patient that it has no refills. This question assesses knowledge of controlled substance regulations, specifically regarding refills. The critical piece of information is that the drug is a Schedule II controlled substance. According to federal law, Schedule II controlled substances are not permitted to have any refills. Even if the prescriptor indicates refills, federal law overrides this. Therefore, the technician should dispense the initial quantity but inform the patient that no refills are allowed and a new prescription will be needed. It is important to know that state laws may vary, but federal law sets the minimum standard for all pharmacies. Question 17. A patient wants to pick up a refill for her blood pressure medication, metoprolol. The prescription was filled 1 year ago, with 11 refills remaining. What should the technician do? I. Fill the prescription as requested, since there are refills remaining. B. Contact the prescriber for a new prescription, as it has expired. C. Fill the prescription for a partial quantity and tell the patient to get a new one. D. Fill the prescription, but only for 6 months' supply. Answer B. Contact the prescriber for a new prescription, as it has expired. This question evaluates understanding of prescription validity and expiration rules. The key information is that the prescription was filled 1 year ago and is for metoprolol, a non-controlled medication. Most non-controlled prescriptions are only valid for 1 year from the date they were written, regardless of the number of refills remaining. After 1 year, the prescription is considered expired, and a new prescription from the prescriber is required before any more refills can be dispensed. Always check the date written when processing refills to ensure the prescription is still valid. Question 18. A pharmacy technician notices that a prescription for Celebrex 200 mg, intended for an elderly patient, has a do not crush warning on the medication bottle. The patient's chart indicates they have difficulty swallowing pills. What is the best course of action for the technician? I. Dispense the medication as is, assuming the patient will figure it out. B. Counsel the patient to crush the medication anyway if needed. C. Flag the prescription for pharmacist review due to the do not crush warning and patient swallowing difficulty. D. Substitute with a liquid form of Celebrex, if available, without consulting the pharmacist. Answer C. Flag the prescription for pharmacist review due to the do not crush warning and patient swallowing difficulty. This question assesses a technician's understanding of medication safety, do not crush warnings, and their role in patient care. The keywords do not crush and difficulty swallowing create a direct conflict that presents a significant patient safety concern. Celebrex, celecoxib, is an extended-release capsule, and crushing it could alter its release profile and effectiveness or increase side effects. The technician's role is to identify this potential problem and immediately escalate it to the pharmacist for their professional judgment and intervention, such as contacting the prescriber for an alternative. Never override such warnings or make clinical decisions. Question 19. A prescription is received for Humulin or Insulin, 25 units subcutaneous before breakfast. The patient has a vial of Humulin or 10 milliliters with a concentration of 100 units/ml. If the patient starts a new vial today, how many days will one vial last? I. 4 days. B. 10 days. C. 25 days. D. 40 days. Answer D. 40 days. This question tests the calculation of days supply for insulin, which is crucial for inventory and patient education. First, calculate the total units in one vial. 10 milliliters * 100 units/ml equals 1,000 units. Then, divide the total units by the daily dose to find the day's supply. 1,000 units/25 units/day equals 40 days. It's important to remember that insulin vials are measured in units, not just volume, and the concentration is key. This type of calculation ensures patients have an adequate supply and helps prevent medication waste. Question 20. Which of the following is a common side effect associated with the use of opioid analgesics like hydrocodone? I. Diarrhea. B. Constipation. C. Insomnia. D. Hypertension. Answer B. Constipation. This question assesses knowledge of common side effects of a frequently prescribed drug class, important for patient counseling and safety. Opioid analgesics, such as hydrocodone, are well known to cause constipation as a prominent side effect because they slow down gut motility. They are also known for causing drowsiness and nausea, but constipation is a nearly universal side effect that patients should be counseled on to manage. Understanding common side effects helps technicians anticipate patient needs and alert the pharmacist to provide appropriate counseling. Question 21. A pharmacy technician is stocking medications and notices two drug products with similar names, hydralazine and hydroxyzine. Which quality assurance strategy is specifically designed to minimize errors involving these types of drugs? I. ABC analysis. B. Par levels. C. Lookalike/soundalike LASA strategies. D. FIFO inventory management. Answer C. Lookalike/soundalike LASA strategies. This question assesses knowledge of medication safety and quality assurance specific to confusing drug names. The concept being tested is how pharmacies prevent errors with medications that appear or sound similar. Hydralazine and hydroxyzine are classic examples of lookalike/soundalike LASA drugs, which are frequently involved in medication errors. Pharmacies employ specific strategies like tall man lettering, e.g., hydralazine, hydroxyzine, separating storage, and using alerts in computer systems to distinguish these drugs. These strategies directly address the risks posed by LASA medications. Question 22. A patient asks a pharmacy technician about the best over-the-counter medication for their severe cough and cold symptoms. What is the most appropriate response from the technician? I. Recommend a specific cough syrup known to be effective. B. Advise the patient to contact their doctor for a prescription. C. Inform the patient that technicians cannot provide clinical advice and offer to have the pharmacist speak with them. D. Suggest a combination product that addresses both cough and cold. Answer C. Inform the patient that technicians cannot provide clinical advice and offer to have the pharmacist speak with them. This question tests the technician's scope of practice and ethical responsibilities regarding patient counseling. The keyword most appropriate response in the context of providing advice about over-the-counter medications is crucial. Pharmacy technicians are not licensed to provide clinical advice, drug recommendations, or therapeutic counseling to patients. Doing so would be practicing outside their scope and could lead to patient harm. The correct action is always to refer such questions to a licensed pharmacist, who has the expertise and legal authority to provide clinical guidance. Question 23. A pharmacy purchases a medication for $25.00. The pharmacy applies a 30% markup on the cost to determine the selling price. What is the selling price of the medication? I. $7.50. B. $17.50. C. $32.50. D. $35.00. Answer. C. $32.50. This question assesses basic pharmacy business math, specifically calculating markup. The concept is to add a percentage of the cost to the original cost to find the selling price. A 30% markup on a $25.00 cost is calculated by first finding 30% of $25.00. 30 asterisk $25.00 equals $7.50. Then add this markup amount to the original cost. $25.00 plus $7.50 equals $32.50. Understanding how to calculate markups is important for inventory management and pricing. Question 24. A patient drops off a prescription for warfarin 5 mg daily. The technician notices the patient is also picking up a new prescription for sulfamethoxazole/trimethoprim DS. What critical interaction should the technician be aware of and flag for the pharmacist? I. Increased risk of hyperglycemia. B. Decreased effectiveness of warfarin. C. Increased risk of bleeding. D. Increased risk of hyperkalemia. Answer C. Increased risk of bleeding. This question assesses knowledge of critical drug-drug interactions, a high-priority area for patient safety. The combination of warfarin, an anticoagulant or blood thinner, and sulfamethoxazole/trimethoprim DS, an antibiotic, also known as Bactrim, is a well-known high-risk interaction. Sulfamethoxazole/trimethoprim can significantly increase the anticoagulant effect of warfarin, leading to an elevated risk of severe bleeding. Recognizing such critical interactions is a vital role of the technician in flagging potential problems for the pharmacist's immediate review and intervention. Question 25. What is the primary purpose of a Material Safety Data Sheet, MSDS, now often referred to as a Safety Data Sheet, SDS? I. To provide patient information on drug side effects. B. To document dispensing errors for quality improvement. C. To provide detailed information on hazardous substances. D. To record temperature logs for refrigerated medications. Answer C. To provide detailed information on hazardous substances. This question evaluates understanding of safety protocols and documentation in a pharmacy setting. The concept of Material Safety Data Sheets, MSDS, or Safety Data Sheets, SDS, is crucial for handling hazardous chemicals safely. The keyword primary purpose directs to the core function. SDS documents provide comprehensive information about hazardous substances, including their properties, potential health hazards, safe handling procedures, emergency first aid, and spill control measures. They are essential for protecting pharmacy staff from chemical exposure. Question 26. A 10-year-old patient weighs 66 pounds. A physician orders a medication to be dosed at 10 milligrams per kilogram per day, divided into 2 doses. How many milligrams should the patient receive in a single dose? I. 150 milligrams. B. 300 milligrams. C. 660 milligrams. D. 1,320 milligrams. Answer I. 150 milligrams. This question tests the ability to perform pediatric dosage calculations, including weight conversions and dose division. First, convert the patient's weight from pounds to kilograms. 66 pounds / 2 lbs / kg equals 30 kilograms. Next, calculate the total daily dose. 10 milligrams per kilogram per day, * 30 kilograms equals 300 milligrams per day. Finally, since the dose is divided into 2 doses, each single dose will be 300 milligrams / 2 doses equals 150 milligrams per dose. Accurate pediatric dosing is critical for patient safety, requiring careful conversion and calculation. Question 27. Which of the following drugs is a common angiotensin receptor blocker, RB, used to treat high blood pressure and heart failure? I. Lisinopril. B. Amlodipine. C. Valsartan. D. Furosemide. Answer C. Valsartan. This question assesses knowledge of drug classifications and their uses, a key part of the top 200 drugs. The keywords angiotensin receptor blocker, RB, and high blood pressure / heart failure directly point to valsartan, brand name Diovan. ARBs work by blocking a receptor that causes blood vessels to narrow, leading to relaxation and lower blood pressure. Lisinopril is an ACE inhibitor, amlodipine is a calcium channel blocker, and furosemide is a diuretic. Differentiating between drug classes like ACE inhibitors and ARBs is important, as they have similar but distinct mechanisms and side effect profiles. Question 28. A pharmacy technician receives a prescription for Cialis 20 mg number 4, take 1 tablet POPRN for erectile dysfunction. Which of the following is an important piece of patient information that the pharmacist must review with the patient regarding this medication? I. The importance of taking it with food. B. Potential interaction with nitrates. C. The need for daily administration. D. Its use for benign prostatic hyperplasia only. Answer B. Potential interaction with nitrates. This question assesses knowledge of critical drug interactions and patient safety. Cialis, tadalafil, is a phosphodiesterase 5, PDE5, inhibitor used for erectile dysfunction. The keywords Cialis and erectile dysfunction should immediately bring to mind the severe contraindication with nitrates, G, nitroglycerin, which are often used for chest pain. Concomitant use can cause a dangerous and potentially fatal drop in blood pressure. This interaction is so critical that pharmacists must ensure patients are aware of it. Technicians should always be aware of such life-threatening interactions and flag them for the pharmacist. Question 29. A new technician is learning about beyond use dating, BUD, for compounded sterile preparations, CSPs. A CSP prepared in a laminar airflow workbench, IFW, in an ISO Class 7 buffer area with an ISO Class 5 primary engineering control, using only sterile ingredients, is considered what risk level? I. Immediate use. B. Low risk. C. Medium risk. D. High risk. Answer B. Low risk. This question tests understanding of USP less than 797 compounding guidelines, specifically the classification of sterile compounded preparations based on their risk level. The keywords laminar airflow workbench, LAFW, ISO Class 7 buffer area, ISO Class 5 primary engineering control, and only sterile ingredients describe conditions that align with a low-risk CSP. Low-risk CSPs are prepared using a septic technique under ISO Class 5 conditions, with no more than 3 commercially manufactured sterile products and no more than 2 entries into any one sterile container. This classification determines the maximum allowable beyond use date for the preparation, directly impacting patient safety. Question 30. Which of the following situations would most likely trigger a prior authorization requirement from an insurance company? I. A generic antibiotic for a common infection. B. A maintenance medication that has been filled regularly for years. C. A new prescription for a high-cost, non-formulary specialty medication. D. An emergency prescription for a life-saving medication. Answer C. A new prescription for a high-cost, non-formulary specialty medication. This question evaluates understanding of insurance billing and reimbursement processes, particularly prior authorization. Prior authorization, PAY, is a process where a prescriber must obtain approval from a health insurance plan before a specific medication can be covered. The keyword most likely trigger leads to medications that are expensive, brand name, non-formulary, or have cheaper alternatives. High cost. Non-formulary specialty medications are prime candidates for requiring a PA because insurance companies want to ensure medical necessity and manage costs. Understanding this helps technicians explain potential delays to patients. Question 31. A pharmacist asks a technician to pull all medications with a manufacturer's expiration date of June 2025 or earlier from the shelves. Which of the following medications should the technician remove? I. A medication with an expiration date of June 30th, 2025. B. A medication with an expiration date of July 1st, 2025. C. A medication with an expiration date of May 15th, 2025. D. A medication with an expiration date of June 1st, 2026. Answer C. A medication with an expiration date of May 15th, 2025. This question tests a technician's attention to detail regarding medication expiration dates and proper interpretation of date ranges. The crucial phrase is June 2025 or earlier. When an expiration date is listed as month/year, e.g., June 2025, it means the medication is good until the last day of that month, June 30th, 2025. Therefore, a medication expiring on June 30th, 2025 is still valid for the entire month of June. Only the medication expiring on May 15th, 2025 is definitively earlier than June 2025. Always remember that the expiration date refers to the end of the month indicated. Question 32. Which of the following federal agencies is responsible for enforcing the Poison Prevention Packaging Act, PPPA? I. Food and Drug Administration, FDA. B. Drug Enforcement Administration, D. C. Consumer Product Safety Commission, CPSC. D. Occupational Safety and Health Administration, OSHA. Answer C. Consumer Product Safety Commission, CPSC. This question assesses knowledge of the roles of various federal agencies in pharmacy law. The keyword Poison Prevention Packaging Act, PPPA, refers to the law mandating child-resistant packaging for most prescription and certain over-the-counter medications. While the FDA regulates drug approval and marketing, and the DEA handles controlled substances, the CPSC is specifically tasked with reducing the risk of injuries and deaths from consumer products, including enforcing the PPPA to prevent accidental poisoning in children. Understanding these agency roles helps clarify which regulations apply to different pharmacy operations. Question 33. A prescription requires 150 milliliters of a suspension to be taken as 10 milliliters twice daily. The technician is asked to calculate the day's supply for this prescription. I. 5 days. B. 10 days. C. 15 days. D. 30 days. Answer: I. 5 days. This question tests the ability to calculate days' supply for liquid medications. The concept involves determining the total daily dose and then dividing the total dispensed quantity by that daily dose. The patient takes 10 milliliters twice daily, meaning a total of 20 milliliters per day, 10 ml/dose * 2 doses/day. The total quantity to be dispensed is 150 milliliters. So the day's supply is 150 milliliters/20 milliliters per day equals 5 days. Always ensure you correctly calculate the total daily usage before determining the day's supply. Question 34. A hospital pharmacy uses an automated dispensing cabinet, ADC. What is a primary benefit of using ADCs for medication distribution? I. Eliminates the need for pharmacist review of orders. B. Reduces medication errors and improves inventory control. C. Increases the physical space required for medication storage. D. Restricts access to all medications to only the pharmacy staff. Answer: B. Reduces medication errors and improves inventory control. This question assesses knowledge of pharmacy technology and its role in quality assurance. Automated dispensing cabinets, ADCs, like Pyxis or Omnicell, are widely used in hospitals. The keyword primary benefit focuses on their most significant advantages. ADCs help reduce medication errors by providing point-of-care access to medications, often with barcode scanning verification, and by limiting access to specific drugs for specific patients. They also improve inventory control by tracking drug usage and quantities in real time, reducing waste and stockouts. ADCs streamline medication management and enhance patient safety, not eliminate pharmacist review or restrict access only to pharmacy staff. Question 35. A patient calls the pharmacy asking for the brand name of fluticasone propionate. What is the most common brand name for this medication when used as an inhaled corticosteroid for asthma maintenance? I. Advair. B. Flovent. C. Spiriva. D. Symbicort. Answer: B. Flovent. This question assesses knowledge of common brand generic drug names, especially for top 200 respiratory medications. Fluticasone propionate is a corticosteroid used to reduce inflammation in the lungs, commonly for asthma or COPD. While fluticasone is also found in combination products like Advair, fluticasone/salmeterol, and Symbicort, budesonide/formoterol, and Spiriva tiotropium, is a different class anticholinergic. The most common single-ingredient brand name for inhaled fluticasone propionate for asthma maintenance is Flovent. Being able to correctly associate common brand and generic names is fundamental for accurate dispensing and patient communication.